Hello everyone. So, I am here to discuss a new topic of universal immunization program. In this program, we will discuss about the vaccines which are under the schemes of universal immunization program. So, let us start with the immunization program which was launched in India in 1978, yes, and the name was given as expanded program of immunization. Okay. This program was launched by Ministry of Health and Family Welfare, okay, Government of India. After some years, so in 1985, the program was modified, the name was changed and it was a universal immunization program. The heading, the same is written here. So, universal immunization program was launched in 1985, yes, which is implemented in a phased manner. At the start it is on the pilot scale only, then it is spreaded to other districts or to cover the whole of the country. Okay. So, we have covered all districts in the country by 1989 to 1990 with the one of the largest health program in the world. Yes. Now, we will see there is a one mission which is known as Mission Indradhanush. Okay. So, what is Mission Indradhanush? See, this is the health mission of the Government of India, okay, and this mission was launched by Union Health Minister J.P. Nadda on 25th December 2014. Yes, what is under this scheme? This scheme is to drive toward 90% of full immunization, okay, coverage of India, and actually this scheme is actually helping. So, we will see the what the reports are saying. So, coverage of India and sustain the same by the year of 2020. Now, what is the results showing after the implementation of Mission Indradhanush? So, before that results, we will see what is the strategy of the mission. Okay. So, what strategies they have implemented under this intensified Mission Indradhanush, okay, which is implemented by the Ministry of Health and Family Welfare India. So, first strategy what they did in this program to complete or to intensify it at up to 90% level. First, single phase intensified Mission Indradhanush from 2017 to 2018. What they did? Each round 7 working days, okay. They have excluded some holidays and intensive monitoring they did. Addition of some need based extra session sites. They have integrated the intensified Mission Indradhanush sessions into routine immunization for sustainability. Yes. So, first of all, what they did, the single phase intensified mission. After that, what they did, gap assessment to identify additional needs. What are the gaps? Why we are not reaching to on larger population? So, what they did, they have focused on manpower. Okay. Then social mobilization they did, means whosoever are the workers or workers at the society level, means there are some ASHA workers or some social activists. So, they will go and they will go to the areas where the peoples are not easily accessing the facilities, and then they will provide the vaccination. So, social mobilization or the finances are the, means what are the gaps under this, okay. So, they did all of these things. Then cascaded training of staff at all levels, okay. So, the staff level trainings they are provided by interpersonal communication, okay. So, all of the healthcare professionals they will talk, they will communicate, okay, and they will plan, yes, what next they have to do. They did also micro planning, okay. So, means at every steps of the program they did planning. So, that is called the micro planning, okay, which is required at the required immediately or urgently what planning we are making, okay, and implementing it. So, after that, head count of for beneficiary listing, okay. So, this head count is done by the jointly by health and women or child development. they have enlisted those areas which should be on top list, okay, which should be on top list priority. So, they have enlisted or updated high risk areas. Okay. After that, what they did, mobilization of identified beneficiaries. So, they did need based communication, social mobilization plan they made at state level, at district level, at block level or at community levels. Then only they have provided the vaccinations to the people. Okay. Now, vaccination of beneficiaries. Okay. So, fixed and outreach vaccination sites. The sites means there are local sites as well. Okay, fixed sites or local sites. So, there are some local sites means which we can mobilize, okay, and fixed sites are the hospitals, dispensaries from where the vaccinations are given to the patient. Yes, the healthy, of course, the healthy persons, not the patient. Now, monitoring. See, under the monitoring, what they did, the regular reviews, okay, they did the feedback. So, regular reviews from national level with states and districts, program monitoring for feedback and action at all of the levels. So, they have checked, finally there is a progress administrative through the administrative data or population based coverage studies, that how much population they have covered by launching all of these, by making micro planning, by making local sites or the fixed sites, how many vaccinations they have provided, how many people are coming for the feedback, okay, how is the feedback. So, they have covered all of these things. This is a strategy by under the intensified mission Indradhanush, and this is you will see in the result part that how it is helped. Okay. So, see, this is the result here. Proportion of children aged 12 to 23 months, okay, fully immunized in 190 intensified mission Indradhanush districts. Okay. So, they have taken 190 districts here, you can see the states or regions. Okay. Now, N is showing here the districts. If you will see the individual states, okay, so like Assam, Bihar, Madhya Pradesh, before the launching of intensified Indradhanush program, what was the scale? You can see fully immunization coverage, okay, and after implementing, there is a blue color, you can see after the implementation of IMI, what is the result? So, you can see the increase, okay, after launching the intensified mission Indradhanush with the strategy what I told you. Yes. So, in this if you will see, these all are the individual states, and if you will see the whole all of the states, the cumulative. So, there are 190 states, and you will see the 18.5% increase in full immunization coverage after the implementation of intensified mission Indradhanush. Yes. So, I have covered about one of the mission. After that, we will see what are the vaccination under the scheme. Okay. So, before the vaccination, we will see what is immunization, what this term is meant for. Okay. So, immunization is the process whereby a person is made immune or resistant to an infection. Okay. So, we are providing some medication or some content which we are saying here as vaccine, and after taking it, the person will be resistant to infectious disease. Yes, vaccines are those substances, okay, they are those content that stimulate the body, okay, body's own immune system, which will protect the person against the subsequent infection or the disease. Yes. Now, what are the vaccinations under the this universal immunization program? So, first vaccination here is BCG. Okay. What BCG mean for? Bacillus calmette-guerin vaccine. Okay. It is given to infant to protect from the TB, okay, tuberculosis. So, it is protecting from tuberculosis meningitis or disseminated, which is spreadable TB. Okay. So, disseminated TB. Now, BCG vaccine is given at birth at 0 year of age, okay, or early as possible till 1 year of age. Yes. Now, route and site. What is the site here? You can see intradermal injection in the left upper arm. Okay. Now, second vaccination is OPV, okay, oral polio vaccine. Now, what is oral polio vaccine? It is protecting the children from poliomyelitis, means polio. Yes. So, it is given at birth at 0 year of age, which is called as 0 dose. Okay. And after that 3 doses are given at 6, 10 or 14 weeks. Okay. Then after that there is one booster dose. So, booster dose is given at nearly 16 to 24 months, means up to 2 years of age. Yes. Now, this is given as the name with the name oral polio vaccine. So, means it is given orally in the form of 2 drops. Okay. After that there is a hepatitis B vaccine. Okay. So, hepatitis B vaccine is for the protection against the hepatitis infection. Okay. This is given at birth or as early as possible within 24 hours, okay, after birth. So, subsequently 3 doses are given at 6 or a 10 or 14 weeks. Okay. And this vaccination is given in a combination of DPT also or HIB. Okay. So, DPT means diphtheria, pertussis or tetanus, or Haemophilus influenza B. Okay. So, sometimes these 5 vaccinations are given in a same formulation. Okay. So, in the form of pentavalent vaccine. So, it is providing the protection against 5 diseases, against the diphtheria, against the pertussis, against the tetanus, Haemophilus influenza B, or of course hepatitis B. Now, what is the route? Intramuscularly it is given at the anterolateral side of mid-thigh region. Yes. After that, see what is pentavalent vaccine. So, pentavalent vaccine I already told you in the previous slide. This is a type of vaccine which is including the content, the antigenic content, and providing the protection to the children against the diseases diphtheria, tetanus, pertussis, DPT, Haemophilus influenza HIB and hepatitis B. Yes. When to give? 3 doses are given. When? 6 month, 6 week, 10 week and 14 week. Okay. Route and site. So, it is given IM intramuscularly and where it is given at mid-thigh region. Okay. After that, see there is a rotavirus vaccine. Okay. So, rotavirus vaccine is providing the protection against rotavirus. Yes. And this agent is causing diarrhea in children, and this diarrhea can be very fatal. Yes. So, there can be mortality, of course, the numbers of mortality we have seen. So, this is also one of the reason why there is a mortality due to the diarrhea in children. So, we need one protection, and for that we have prepared a rotavirus vaccine. So, it is given in some of the selected areas where the children are more prone for this infection. Yes. So, when to give? There are 3 doses of vaccine are given. Okay. Same 6, 10 and 14 weeks. Okay. What are the route and site? So, if you will see this vaccine is given orally and 5 drops are given. Okay. There are 2 type of preparation here, liquid vaccine, or there is a some formulation we have changed here, lyophilized. One of the process we did in this lyophilized vaccine. So, the drops here we can see 5 drops under this liquid vaccine formulation and 2.5 ml if we are providing the lyophilized vaccine. Okay. After that, there is a PCV vaccine which is under the universal immunization program. So, what is PCV? PCV is providing protection against pneumonia. Okay. So, PCV stands for pneumococcal conjugate vaccine. Okay. And pneumonia which is caused by streptococcus pneumoniae. Children and infants are more prone for this infection, okay, this respiratory tract infection. So, when we will give this? See, the vaccine is given as 2 primary doses, dose at 6 or 14 week, okay, and then there is a one booster dose which is given at the 9 to 12 months. So, we can say at up to 1 year of age. Okay. Now, how it is given? So, route and site, it is given IM. So, most of the vaccinations if you will see they are given by IM route, okay, intramuscular route. PCV is also given IM injection in anterolateral side of mid thigh. Okay. So, this is the region you will find even in the previous slides also. In this region most of the vaccinations are given. Okay. It should be noted that pentavalent vaccine and PCV, okay, they are given as two separate injection in opposite thighs, otherwise there are chances of adverse reaction. Okay. After that there is FIPV. Okay. This is also one vaccination under the universal immunization program, fractional inactivated poliomyelitis vaccine. Okay. Now, this vaccine is used as boost, okay, to provide protection against polio infection. How it is given? 2 fractional doses of IPV are given intradermally. So, here what you will note, it is given ID, intradermal or at the age of 6 or 14 years of age. Yes. How, what is the route or the site? So, the same intradermal injection is given, but where? At right upper arm. Okay. After that there is a measles and MR vaccine. So, measles vaccine will provide the protection against the measles infection, whereas the MR is the combination of measles and rubella. Yes. So, measles vaccination is providing protection against measles. In few states measles and rubella a combined vaccine is given, means there are some of the epidemic areas, okay, where the cases we have seen the number of cases are more, or where the infection actually existed. So, for those of the areas we are providing these vaccination to the children. When to give? First dose of measles or MR vaccine is given at 9 completed month to 12 months. Okay. So, this is given at 9 to 12 month, and vaccine can be given to 5 years if not given at 9 to 12 months age. So, there is a one relaxation. Okay. And second dose, this is the first dose I told you, and second dose is given at 16 to 24 months. So, approximately we can say at the age of 2 years. Okay. How will give this vaccine? So, this is given by SC route, subcutaneous, okay, in the upper arm area. Now, there is also one infection which is known as Japanese encephalitis. Okay. So, for that infection, to prevent that infection, we have vaccination for children, Japanese encephalitis vaccine. Okay. Now, see, it is also in the same manner as I told you in the previous slides also, Japanese encephalitis vaccine is given on those areas which are epidemic, okay, to Japanese encephalitis. When it is given, so see, there are 2 doses are given. So, first dose will provide nearly to the 9 to 12 month, and second dose will provide from 12 to 16 to 24 months. Yes, means first is up to 1 month, up to 1 year, and second is up to 2 year. Yes. What is the route? How will give this injection with this vaccine? So, first of all, this is a live attenuated vaccine. Okay. This is given SC, subcutaneous, in which of the area? Upper arm. Yes. Or there is also one vaccine which is called as a killed vaccine. Okay. So, we have what we did in this killed vaccine, we have controlled the antigenicity of the virus. Okay. So, in this killed vaccine which is given by this route, IM route, and in mid thigh area. Okay. After that you will see a DPT booster. So, in the DPT booster, diphtheria, pertussis and tetanus, this is given as booster dose also. So, this vaccine is providing the protection against these 3 diseases. Okay. It is given at 16 to 24 months, okay, the first booster, and the second booster is provided at 5 to 6 years of age. Okay. How will give this vaccine? So, it is given by IM route, okay, IM route in mid-thigh area, okay, and second dose is also provided in the IM form, IM injection, but here we can see it is provided in the area of the left upper arm. Okay. So, there is a one difference in the site. Now, coming to the tetanus, TT or adult diphtheria. Okay. So, there are vaccination named as tetanus, TT, or there is a one vaccination which is TD. TD means tetanus and diphtheria. Okay. TT has been replaced by TD nowadays. Okay. So, nowadays we will see this type of vaccination, tetanus and diphtheria combination. See, TT vaccine has been replaced with TD vaccine in universal immunization program to limit the waning immunity against diphtheria in the older age groups. Okay. So, they are the adults who are suffering from the diphtheria, we can protect them. When to give? TD vaccine means tetanus and diphtheria vaccine, it is administered to the adolescent at 10 and 16 years of age or to the pregnant women. Most of the in the pregnant women we have seen there are sometimes complication of tetanus infection, okay, and these tetanus infection are the are causing the mortality in the pregnant women. Yes, so we have to reduce it. For that, it is compulsory or mandate to give TT, tetanus injection, in the pregnant women or to the adolescents as well. Now, see, for the pregnant women, what is the point under this? TD 1 is given early in the pregnancy at first dose, okay, and 4 weeks after TD 1 second dose is given, which is called as TD 2, okay, and TD booster, after that TD booster is given. Okay. What is the route and site? You will see IM it is given and to the upper arm area. So, this is the table. You can see this is the conclusion form, and the ages are written here. Which vaccine we have to give at birth or at 6 weeks or 10 weeks, 14 weeks, 9 months. There is also inclusion of vitamin A. Okay. In children we have seen some vision problem. So, for that we have included vitamin A as well. Okay. So, you can see vitamin A 2 lakh international units is given. Okay. When it is given we will see it. Then 16 to 24 years of age, okay, 5 to 6 years, then which vaccine will give at 10 years and which to give at 16 years or for pregnant women. Okay. So, in the pregnant for the pregnant women you can see tetanus is very important, TT1 or TT2. Okay. So, we will see what are the vaccines here. At birth, BCG, yes, BCG, OPV, oral polio vaccine 0, okay, and hepatitis B is given at age 0. Okay. At 6 weeks means 1.5 months. So, DPT, diphtheria, pertussis, tetanus, dose 1, OPV dose 1, hepatitis B dose 1, Haemophilus influenza dose 1, rotavirus dose 1. Okay. In a similar manner you can see like dose 2, okay. These dose, second dose are given at the 10 weeks, okay, and the third doses you can see at the 14 weeks, and at the 9 months which vaccination we have to give? Measles first dose, okay. Measles first dose cannot be given before the 6 months. So, measles first dose or vitamin A 1 lakh international units or Japanese encephalitis, okay, vaccine. Now, after that you can see vitamin A 2 lakh international units should be given every 6 months till the age of 6 years, so that the child will not suffer from the vision problem. Okay. What vaccination we have for the 16 to 24 years? So, we can say DPTB booster dose, OPV booster dose, Japanese encephalitis vaccine, measles second dose, Okay, which vaccination we can give at 5 to 6? DPT. And the tetanus, we are seeing the tetanus injection, these ages also are taking the tetanus injection. For the pregnant, it is compulsory to take tetanus 1 or tetanus 2, okay, 1 month apart. If TT booster will give to the pregnant women if 2 TT doses received in last 3 years. Okay. So, this is the whole of the scheme, how will provide the vaccination, which vaccination to be provided at which of the ages. Okay. So, I hope this is clear to all of you, universal immunization program. In the next session, we will meet with our next program. Thank you so much.